Dr. H.B. Sharan. So this was you're part of the same session, is it? Okay. So you'll be talking on retinal and choroidal microvascular alterations in HIV in individuals using OCTA, a cross-sectional analysis. Okay.
Good morning, everyone. Myself, Dr. Sharan HP, resident AFMC Pune. I'll be presenting a paper on assessment of retinal and choroidal microvascular alterations in HIV-positive individuals using optical coherence tomography angiography with CD4 count correlation. Retinal microvasculature offers unique opportunity to study microvascular changes affecting systemic vascular health. Current study investigates subclinical microvascular changes in well-controlled HIV-positive individuals using OCTA. There are many other studies show these clinical changes. Aim is to evaluate the retinal and choroidal microvascular changes in well-controlled HIV-positive patients on ART using OCTA. Primary objective is to investigate differences in macular vessel density and vessel length density between well-controlled HIV-positive individuals on ART and healthy controls using OCTA. Secondary objective is to assess the foveal avascular zone changes among HIV-positive individuals, and the last objective is to assess the microvascular changes in HIV subgroup. Study included individuals between aged 18 to 60 years, and they had best corrected visual acuity of more than or equal to 20/25. They had undetectable viral load, stable ART for at least 2 years, and the availability of recent CD4 counts. Those who were excluded from this study were refractive errors, patients having refractive error equivalent, spherical equivalent of more than plus or minus 6 diopters, poor quality of OCTA images, and clinical signs of HIV-related microvasculopathy or any systemic or ocular pathology affecting the retinal microvasculature or history of intraocular surgery or trauma. It was a cross-sectional study conducted between 50 HIV-positive patients on ART versus age and sex-matched 50 healthy controls. OCTA scan was performed using Heidelberg Spectralis machine, and through a software we measured the vessel density and vessel length density, and manually we measured the foveal avascular zone in superficial and deep layers. HIV positive patients were again subdivided into low CD4 group with less than 350 cells per cubic millimeter, and normal group that is CD4 count more than 350 cells per cubic millimeter. And this picture is showing the skeletonized images of OCTA scan. Pic A showing the nerve fiber vessel density, B showing the superficial vascular plexus density, C showing the intermediate vascular plexus, D showing the deep vascular plexus, E and F showing choriocapillaris and choroid respectively. Results: superficial vascular plexus vessel density was significantly lower in HIV group, and surprisingly choroidal vessel length density was significantly higher in HIV group. There was one non-significant finding: foveal avascular zone area was larger in HIV group, and there were not statistically significant results. They had weak correlation trends with CD4 count. Low CD4 subgroup had lower SVP-VD and higher choroidal VLD, and this graph shows the VD comparison. We can see the controls having more SVP VD, and then this graph again shows the VLD comparison. Here we can see cases having more VLD compared to controls, and this one is a non-significant finding, though in superficial vascular plexus we can see there is increased FAZ of cases. And discussion, there was a reduced SVP VD suggestive of early vascular changes, but previous studies showed decreased choroidal VLD, but our study showed increased choroidal VLD, and trends align with the previous study showing FAZ enlargement and VD reduction. OCTA can serve as a non-invasive biomarker for systemic vascular health in HIV. So I would like to wrap up with the points. HIV positive individuals shows retinal and choroidal microvascular changes even after starting ART, lower SVP-VD and higher choroidal VLD, especially in low CD4 counts. OCTA is a useful tool for early detection of vascular dysfunction, and this might aid in the monitoring of systemic vascular risk in HIV. We further need studies for longitudinal correlation and say with systemic inflammatory markers for the further follow-up of these findings. Thank you.
Thank you, Dr. Sharan. So did these OCTA findings also correlate with any clinical findings that you saw on fundus examination?
Ma'am, that was the exclusion criteria, ma'am. Clinically, nobody had any features on fundus examination.
Something, you know, like subtle signs of ischemic maculopathy where you see an alteration of the background.
Nothing was there, ma'am.
Nothing, they were all
was
absolutely.
there. Any visible fundus finding were excluded from the study.
Excluded.
Yes,
Okay. So what applications do you think this would have in the future?
Ma'am, we can just predict those patients who are going for any vasculopathy, any retinopathy in the future, ma'am, in HIV patients. It is a non-invasive study basically, so we can predict with the use of non-invasive study.
Any systemic correlation that you know
only
that you
CD4 count was considered, ma'am.
No, what are you hoping to, you know, you said that in future it can predict vascular health. So just the retinal vascular health or the systemic vascular health as well?
There were few studies which included systemic vascular health also, ma'am, along with target organ damage. So our study is basically concentrating on HIV eye vascular health, ma'am, retinal vascular health.
Thank you.